Today I would like to discuss a skin disease called psoriasis. It is an autoimmune disease, and I believe it is very important that people are educated on this disease, as there are many assumptions and misconceptions that people have when they see or come in contact with the skin of a psoriasis sufferer. Psoriasis is not only a skin disease that affects the aesthetics of a person, but also their mental and physical being as well. It is important to educate yourself on psoriasis, since it is a skin disease that is looked over and widely misunderstood. There are a few main points that I would like to cover: types of psoriasis, areas it can affect, psychological effects that it can cause, the treatments, and what you should know about psoriasis. According to the National Psoriasis Foundation, it is described as a contagious, chronic inflammatory, painful, disfiguring, and disabling autoimmune disease for which there is no cure. There are 5 different types of psoriasis that can affect different areas of the body and have different symptoms as well. The first one that I want to talk about is plaque psoriasis. According to the National Psoriasis Foundation, about 80% of the people who have psoriasis suffer from this particular type. It's mostly found on the elbows, the knees, the scalp, the lower back. It's basically raised, inflamed lesions, and it's covered with dried, scaly skin. Guttate is also another type of psoriasis. However, these lesions are not as thick as plaque psoriasis, and they cover the body in the form of small red dots. Inverse psoriasis affects the more sensitive skin areas, mostly the folds of skin under the breasts, the armpits, behind the knees. It appears as red lesions that are more flat and smooth than that of plaque or guttate psoriasis. Pustular psoriasis is another type. It's usually seen in adults, and it appears as blisters that will group together in pustule form, dry up, and then flake off in sheets of skin. Erythrodermic is perhaps the worst and can be fatal. It can cause heart failure, pneumonia, severe dehydration. It affects almost the entire body, and then once the skin sheds off, it comes off in sheets. Psoriatic arthritis is also another type. This can affect the nail beds and the joints. It can swell the joints up, and if it progresses, it can cause permanent deformities. So knowing the types of psoriasis is important. However, the effects that they cause shouldn't be overlooked either. Some of the psychological effects that they can cause are feelings of embarrassment or shame. This can cause the psoriasis sufferer to shy away from social interactions. When the disease gets out of control and attempts at treatment are unsuccessful, then the individual can feel helplessness, frustration, or anger. Intimate contact can also be an issue for these individuals that suffer from psoriasis. Sometimes the lack of social interaction or even constant worry about appearance or the way they are perceived can cause depression and even thoughts of suicide. So now that we know the psychological effects that it can cause, let's move on to the treatment options and important things that you should remember. Although there is no cure for psoriasis, there are many treatment options. The first treatment is usually topical. This includes ointments, corticosteroids, creams, and topical steroids. Another popular treatment is phototherapy, which is the exposure of the skin to UVB rays. This is said to slow the growth of the skin cells. There are internal treatments such as pills and injections. And just recently, laser treatments have been approved to help reduce the symptoms of psoriasis. And there are some important things that you should remember, especially if you have a friend or loved one who suffers from psoriasis. Psoriasis is not contagious. You cannot contract the skin disease by contact with a person who has it. Psoriasis can be very painful. The skin can be very tender and raw with a constant burning sensation. It can also have a constant itch, which can cause scratching to the point that the skin opens up and bleeds. The actual cause of psoriasis is unknown. However, it is known to be an autoimmune disease. There is no cure. Things you can do to help are as simple as just being kind to a psoriasis sufferer. Remember that their struggle with illness cannot be hidden. It may not be life-threatening, but it affects the individual in many other ways. You can also educate yourself by participating in research study groups. These studies require subjects with and without psoriasis. You must also be patient with a psoriasis sufferer, especially if he or she is your spouse or loved one, because everyday things like bathing, applying topical treatments, and getting dressed can be painful and frustrating. And I hope that you have gained more insight on this disease and will now have a better understanding of what a psoriasis sufferer goes through.